This is a hot one. Kind of thing that raises eyebrows in the medical establishment, of course. And in the face of this wave of legalization come questions as to what constitutes proper allowable usage of a plant or a family of plants that has been here on this planet for many, many, many millions of years before any human came upon this planet, and thus, for the most part, is utilized in its natural state, and as such raises questions of many types regarding regulations and restrictions on its use by humans when it is so often being used in its natural state. What I am most concerned with is those who are using it. And if they are using it, are they using it for some conditions for which it is intended to assist them in their healing? That is why I am interested. That is why I am concerned. I am a physician. I am a healer. I have responsibilities to assist people in realizing their powers of healing and remembering their right to heal. I am also trained in addiction medicine, in preventive medicine, in mind-body medicine. I also have a doctorate in applied spiritual healing. I have many credentials, so to speak, in many years of training in Western medicine, Eastern medicine, and other forms and approaches to healing. This does not qualify me to dictate to anyone, but what it does do is it gives me many different perspectives to look upon important problems and trends in society that affect health. During the year of 2014 into early 2015, I was actually gifted with the opportunity to evaluate approximately 5,000 patients in my clinical practice. So I took that responsibility. And each day, I had anywhere from 25 to 40 plus patients who would come in, and I would give them a medical evaluation about their use or possible use of medical cannabis for their conditions. So that 5,000 was a pretty good real-life experiential base and not just a review of literature or an experimental environment of a designed clinical trial study. This was real-life, day-to-day, in a clinic, experiential, not experimental. So I got a chance to witness many things. One of the things that struck me that was so amazing was to find out indeed how many different clinical conditions for which medical cannabis is positively efficacious, effective, safe, quick, easy, and with minuscule side effects. I found perhaps on the order of close to 100 different conditions and symptoms that could be affected, favorably so, by the use of some variety or some combinations of medical cannabis. And yet at the same time, while so many of these people were having these experiences of being able to manage their chronic conditions and not have to depend on expensive and oftentimes discomforting pharmaceuticals. Sadly to say, I noticed also they were not healing. They were using cannabis or medical cannabis for years and years and years, happy to have it, and especially happy that it is becoming more legal for them to have it, so they don't have to be in the closet in possession of it and use of it. And this is all good. Yet they were also still not healing. And as a healer, I am compelled to address, why is healing not taking place? If you are taking this medicine now, this natural plant medicine, and it is so effective for you, why is it not effective enough that you are healed? Why must you still use it or need to use it so often, for so long? And this became the question that I began to probe in my meditations, and that I began to open the conversation a little bit more broadly too. Because as many of you realize, that when a doctor has a lot of patients waiting, the pressure is on that doctor to go fast, fast, fast. And so a lot of these environments are quick in and out environments. Fill out a little questionnaire, give a little comment about an update, get your prescription and get out the door. Well, this is no different for most of these medical cannabis clinics than it is for your own doctor's office of your primary care doctor or the specialist doctor that you see. That I understand truly why a patient is there that day, and that they understand truly the most that I can possibly give them in that time frame, which has been extended, to help them be empowered to understand, to reclaim their right to heal, and to step up and be willing to take the responsibility for their healing and be held accountable for such within the limits of available knowledge and reasonable expenditure of their energies. That's true empowerment. I have essentially distilled it down through my meditations and my interviews with patients. And I realized that there are essentially 3 different ways to use cannabis. One of which is recreational, one of which is medicinal, and one of which is spiritual. The recreational usage of cannabis can be, and often is, combined with medicinal use of cannabis, and vice versa. Many of them found themselves looking primarily at medical usage for their cannabis, and yet a certain percentage of them also came to occasionally partake in a recreational manner. Recreational manner is somewhat loosely defined. Many people obviously use it to get high or get buzzed or something like that, you can say. Others, some of that boundary between medicinal usage and recreational usage actually is blurred, because people sometimes are using it for conditions or situations other than for which they acquired the medication as medicine. So, for example, if someone is taking it for a pain condition, a chronic pain condition, they may occasionally just feel a little more stressed in the evening, and they may then take some to unwind and help them relax and have a better night's sleep. I wouldn't count that as recreational per se, though I would consider it as outside of their scope of indication for which they were officially acquiring their certification to use this. Then, of course, there are people who have a history of recreational use of cannabis and also have medical issues. And so for them, it's a natural extension to be able to get legal access to prescription cannabis, and why not use it again also from time to time in their recreational mode. So yes, quite a number of patients that I saw were using it for both categories of usage, recreational and medicinal. However, a quite substantial percentage of that crossover population was still pretty disciplined for the most part when it came to understanding and using for medicinal sources or medicinal purposes in an appropriate kind of way. There's a lesser population for whom cannabis would be used medicinally and spiritually. We use sacred medicines, plant medicines, in cultures all around the world. Every culture on this planet originated with the use of plant medicines as primarily what sustained it. The pharmaceutical industry, of course, has come to supplant the indigenous or the indigeneity of the plant pharmacopoeia, and to suppress that. This is true. So there's naturally been some availability of knowledge on how one may use it, or at least want to undertake the usage of it in some sort of spiritual, ceremonial way. So, the simple approach is this. I would tell patients that if you are looking to use cannabis, if you are using cannabis recreationally, then you are taking dope. Plain and simple. That's your dope. That's your drug. And for most states at this time in history in this country, that's not permissible, with a few exceptions. And of course, those exceptions are growing. And yes, there is an increasing legalization movement for recreational use. However, that is not the physician's primary area of concern, nor primary area of responsibility. If you are looking to use it medicinally, then there are these guidelines to follow. And for that, without going into specifics too much, I would simply have anyone who's interested that way inquire of your physician and inquire of your local facilities, the local clinics that do those certified, legal, proper medical evaluations for such. You are not likely to find places to go and buy medical marijuana primarily for use in spiritual settings. So what does that look like? So I'll address that. But I want you to understand, first of all, that if it is your intent to use cannabis in any form, recreationally, you can still use it medicinally, and vice versa. If it is your intent to use cannabis medicinally, and you wish to use it spiritually, you can, and vice versa. What you cannot do is mix recreational use and spiritual use. This is not permissible. It is not permissible in the sense of what we need to achieve to heal. It is not permissible from an ethical or moralistic construct. It is not permissible from a shamanic construct. It is not permissible because in order to heal, via the usage of medical cannabis or cannabis in general, it must be regarded as sacred. And you do not recreate with the sacred. This is also the reason that people have been using cannabis for years, sometimes decades, and they come in, and when I ask them that question, why haven't you healed if you've been using it and it's so wonderful, it is so effective for you? And it is because they've tried to mix this, they've tried to cross the barriers of recreational use and into something else. If you're using it recreationally and you are using it medicinally, you may be very, very pleased and satisfied in the management of chronic conditions without healing chronic conditions. If you wish to heal, then you must release any usage of recreational settings. There's a simple rule and law of shamanic healing practices throughout the world. You do not desecrate the sacred. So, what does it look like if you wish to heal? Okay. The first thing that I would encourage people to do is to examine their current usage, the settings of their usage, when and why they are using it recreationally, when and why they are using it medicinally. And then we begin with the focus on the medicinal. Do you understand what it is that you need to use that is most appropriate for your symptom complex? Do you understand this? Do you understand the effects of the different strains upon your body for different symptom complexes or different syndrome complexes? Do you understand this? If you are using cannabis without an understanding of the differences of the strains, then yes, you will definitely be quite limited in the effectiveness of this cannabis and the approach to utilizing it to achieve your healing. If you are using it also recreationally, then more than likely you are ingesting through whatever means more so than you need for medicinal use. But it is important to understand that. If you are clear in your distinctions between recreational usage and medicinal usage, and you are clear as to what types you may be using at different times, what strains or which combinations of hybrids, then you have something to work with. So that's the first thing that really needs to take place. A person needs to be very clear in identifying their usage patterns. And then if they are looking to heal, it is not worth any effort to try to guide them to healing if they are not ready to release their attachment to recreational use. A physician is a healer and a guide for healing. However, a physician cannot assume the responsibility for someone who does not choose to heal. I advise them to ask me again when they're ready to heal. Ask me again once they've decided they no longer need recreational usage in their life. When they have begun a practice of meditation, when they have looked upon themselves spiritually and asked themselves, how am I this way? Do I have a spiritual orientation to my life? Do I have a spiritual practice? Whatever it is, do I have one? Have I cultivated any spiritual discipline? Any practice of meditation especially? And most importantly within that practice of meditation, any stillness practice. If this hasn't yet begun, it must begin. It's important to feel comfortable, properly at peace with yourself when you begin a process which itself is designed to bring even deeper peace. Yet if you are in conflict with this because of your understanding, then it is important for you to get the understanding that also supports your going forward in this way. Once that is clear and a person has begun some basic practice of meditation, and they feel comfortable that they have a technique now that can take them fairly quickly into a deep state of reverence and a deep state of relaxation, then they may be ready. The second question for them is, am I really, truly ready to heal now? If I've been using this or carrying this ailment or collection of ailments around for so long, do I understand what it takes to heal it rather than just continue as a chronic disease or chronically afflicted person? My pain is my excuse. My fatigue, my insomnia and my anxiety are my excuse for my impertinent behavior, for my unkindness, for my job performance. So there's a whole lot more there also for the person to take personal inventory about. And if they are doing such, then you can see that they may become ready to embark on a journey which is to attain a healing, actualizing of an intent to heal, often in the setting of someone who has decided it's time, and it's time for me to let go of a dependency on a substance to be the mode of my relaxing, the mode of my peaceful sleeping, the mode of my pain relief, when it has been so effective, albeit temporarily so at any time, but so effective. It's something that most physicians in their current roles as doctors in this country would not feel qualified, knowledgeable enough, committed enough, nor available enough to assist their patients in guidance. Once the patient has understood how much they are using cannabis for recreational use and how much they are using it for medicinal use, and then they decide no longer to use it recreationally, and they have incorporated the meditation and stillness practice into their life, then they are learning to witness. They're learning to witness themselves. What I discovered was the vast majority of people, once they begin to witness themselves accordingly, find that they are using it medicinally even more than they require, than they truly require. So one of the immediate benefits of this inventory and this decision to release oneself from usage of recreational cannabis in favor of beginning a journey of true healing and rather than chronic symptom and disease management is the medical requirement goes down. So that's an initial gain, even before they've truly gone into healing mode. The actual requirement of usage, of dosage, goes down. Usually surprising news and pleasant news to the patient. The second thing that I tell them then, now that you no longer are using recreationally, what you have access to is medicine and sacrament. Medicine and sacrament are to be kept separate from one another. Your prescription for your medical cannabis, when you use it as medicine, I recommend that you keep it stored appropriately in your home in accordance with the laws. If you are using it in transport, in travel, that it is handled appropriately in accordance with the laws. When you are using it as sacred substance, as sacrament, even in your own home, I recommend that you keep it separate from that which you use as medicine. What you need for sacred usage is a small amount, but it may be quite different from what you need for your primary medicinal usage. What does that look like? Essentially, you have three categories of medical cannabis. One is the strain of cannabis indica. The second is the strain of cannabis sativa. There are quite different effects that those two strains have upon the body, particularly as psychoactive effects. Some of the other corporeal effects, systemic effects upon the body, are comparable between the strains. The third is what is called the CBDs, the cannabinoids or the cannabidiols. These are minimal to negligible to absent in their psychoactive effects. And these are used primarily to stimulate the immune system. So a simple approach to using cannabis in the spiritual sense, in the healing environment. First, I have the patient, I tell them, go when you are having approximately an hour of undisturbed time that you anticipate in your home. Turn off your phones, televisions, have your other family members understand that you're doing something that's very important for your health in a proper, quiet setting. Give thanks for your medication. Ingest your medication in whatever is the way that you feel most comfortable for you, for the particular symptoms that you are treating at that time. You would know what is the best medication to use. If you have been in consultation with your doctor, have that guidance, professional guidance, so that you know what it is that you need to take. And assuming that that is in place, then ingest if you are symptomatic. If you are not symptomatic, there is no need to ingest by whatever means. Smoking, edibles, oils, any of these, vapors, etc. But if you are symptomatic, then take just simply the minimum amount to give you relief of that symptom. It doesn't have to give you complete clearing of that symptom at that time, but just bring you to a comfort. Give yourself a bit of time for that. And when you feel that that is coming into a manageable, reasonable range for you, then you can shift your attention to what is in essence a shamanic process. I recommend that you hold a special place in your home, your sacred space. It may be a small corner, it may just be a little table, if it is your altar, so to speak. It's where you meditate. It's where you hold in highest regard, perhaps some mementos of family, friends, loved ones. Perhaps you may use crystals and crosses and other things of this sort, or not. But let it be a dedicated place for you that you use for your meditations and your sense of your spiritual practice, especially for stillness. It is there where you should also store, if possible, the small amount of cannabis that you would use in sacred ceremony. Because as you are in continued meditation practice over time, you build up a morphogenic field in that space, your sacred space, and thus the energy of that space will be different from the energy of the rest of your home. If you use a chair, preferentially to use that chair consistently for your meditations, and generally not to have it used by others, generally, or for other purposes, generally, if you can. In this sacred space, you build and create a dense field of spiritual energy which is promotive of your self-realization. And that self-realization path is your path to healing. So, how do you do it now from this point forward? Understand that the effects of cannabis indica as a strain, as a variety, these effects energetically and spiritually work primarily in the heart center, what we call the heart chakra. The energy channels of the body, which are very sensual, much connected with emotions, very much connected with the calming of anxiety states, the curbing of anger states, with the lulling into sleep, into deep relaxation, with this feeling of connection that people seek. So energetically, we're working with the fourth chakra, the heart. Therefore, the most appropriate strain of cannabis is cannabis indica for that. A small amount. As I mentioned, CBDs are most concerned with the immune system support, and therefore, the center for the immune system is the thymus region, just above the heart, at what is called the carina, the bifurcation, the branching area in the chest of the great vessels and airways. Also, the middle of the breastplate, the sternum. In this area, we have the thymus. The thymus is also known as the origin site of what are called the killer cells, the T cells, and other elements of the immune system. When we are born, the thymus gland is essentially as large as the heart. And as we gain in age, and as we vaccinate more and more and more and more and more and more, the thymus gland is driven towards a near atretic state. It is suppressed. By the time we're adults, our thymus gland is a small little, not much larger than a walnut organ. In fact, so often, if you read reports from radiologists of CT scans and MRIs done of the chest, you hear mention of the lungs and the heart and the great vessels. Rarely do I hear mention of the thymus. It's almost an incidental finding. And so, therefore, it needs to be supported in any condition, because energetically and psychospiritually and biospiritually, it is the seat of the immune system, and it resides just above the heart. The third element is the strain of cannabis sativa. Those who have partaken of cannabis sativa knows that it has a stimulating effect on the mind. Its psychoactive properties tend to be much more along that lines of what you could call the proverbial high, getting high. This is why it would be the predominant form of illegal use for so many decades. But actually what it is also doing is working in the higher chakra centers. It works in the sixth brow chakra, also called that of the third eye. And it works in the crown chakra, what we call the fountainhead. It is there where we begin to have these higher spiritual experiences, those who are guided appropriately in shamanic ceremonies, in sacred environments. So I recommend that a person have a small amount of each of these three, or that they have what is a good hybrid combination of the three. To undertake the spiritual ceremony for healing using medical cannabis, I recommend then what I call the 5 fives of ceremony. These are 5-minute spells of segments of meditation. The first 5 minutes, which one begins after one has prepared their sacred space and brought out their sacred substance, perhaps prayed a little bit, because this is what sacredness is about. So this is different from the previous experience of the medicinal usage. In that first 5 minutes then, they are simply allowing themselves to go deep into meditation. You see, you must be practiced in order to go deeply into meditation, and with only a 5-minute window, there's a need for release. And this is why, if you were symptomatic a little while before, you may have needed to use a little bit of the substance in its proper medical context to take that edge or reduce the intensity of those symptoms that you may have been experiencing. Yet if you were not, then it is not necessary, as I said, and you can go directly into this phase. 5 minutes, deep stillness practice, meditation, relaxation. Allow yourself to sink into the sacredness of the moment and the setting. Acknowledge with gratitude this journey that you are undertaking. Be not afraid and be not doubtful that a condition that you may have been holding in your body-mind for 20 or more years, be not doubtful that it can be healed, because it still can be healed. It takes a lot, yet this is where your faith and this is where your knowing and this is where your journey begins, with the declaration of your healing. For if you do not declare your healing, you cannot actualize that right. So that's the first 5 minutes. Open your eyes, look around a moment, sort of take stock of where you are, appreciate the state of relaxation that you've entered into, appreciate the sense of sacredness that you are part of, and then I recommend you begin with the medicine and sacrament. Again, as I say, if you're beginning with a hybrid, that is a well-balanced hybrid of the three, then you only need to partake once. If you have separate elements, then I recommend that you begin with the cannabis indica, a small amount. As you partake of the indica, you go back into meditation. 5 minutes. Your focus at that time is on infinite unconditional love. Your focus is on connecting with the great spirit of the plant medicines, connecting with God, connecting with Creator, with Source, with the universe as you understand it. Connecting through the channel of infinite love, that your heart be filled with this love. If you are one who particularly likes visualization, you may choose to visualize a light that is a golden white light that is sacred, that is infinite of love, that is beaming from the center of the galaxy or from the heavens. But that this light brings you this infinite love, and it comes across the skies, across the heavens, and it enters into the top of your head, and it comes down, and it comes down into your heart. And it's a continuous stream of light that flows, fills your heart. Secondly, then, that you visualize a light that comes from the center of the earth. And that light is a blue-green light, and it comes through all the solidity of the earth, all the magma, the oceans, comes through the floor of your house, and it comes through your base and enters up to your heart, and it joins with the golden white light. These you can visualize. And because we have an expression that says, energy flows as attention goes, you're activating energy channels. You're unifying these energy channels in your heart chakra. And as you do this, you may experience sensually a great fullness in your heart and a great swell of love and compassion. This is intended. This is part of a process of opening your heart. During this time, you may call forth God, angels, guides, ancestors, or just simply love. Once you're in this state, this is a guided meditation, and it's very, very, very effective. You can feel yourself so full of this light and this love that you allow it now to emanate from your heart as the lights are mixing in a spiral together. They're filling your body. Of course, they are going to those areas of your body where you have had illness or infirmity, injury, and symptoms. They're filling your body completely, and then they are expanding beyond your physical body. And you will know this. You will feel it. You will feel a decrease in the boundary nature of your skin, of your muscles, of your clothing, of your seat, and you will feel yourself becoming less a distinct being from your surroundings. And you will just allow the love to continue to flow forth from you. Let it flow. Let it expand. Let you, in your heart and your love, fill the room. As you do so, simply declare, through love I am healing. Through love I am healing. Through love I am healing. You allow this expansion to take place further until it fills your home or the building in which you are residing. Continuing, I am healing. With love I am healing. You continue the expansion until you are beyond the building. Your heart and your love is filling the whole neighborhood. It expands and it expands. With love I am healing. It expands until it fills the whole city, the whole town, until it fills the county, the region, the state, the region of the country. With love I am healing. Infinite love is coming to you because it is coming as divine Father, divine masculine, cosmic masculine and Father from the heavens. It is coming as divine Mother, divine feminine from the core of our Earth Mother. You are fed with infinite love, and therefore it is no effort to expand infinitely. From your heart, you expand and expand until the entire country, the hemisphere, and even the world is filled with your love. As you are so doing, you will notice in your body. Moments of discomfort. In those moments of discomfort, you just simply give attention to them and direct a little more of the love in a focused way while you still are expanding to that particular part of your body that may be calling out for some additional attention. That is what a symptom is. If you'd like, you can even go beyond this planet with this expansion. You can expand, allow yourself to have the whole world spinning inside your heart. Imagine that. You are now the source of love so great that you cover and you infuse, you cradle and you nurture, you embrace and you love the whole world. Now during this time you might notice a few things. You might have some flashes of moments of conflict or resentment or anger, even fear, guilt, shame, blame, jealousy, rage. You may notice these flashes, moments of your life, moments of your interacting with others, moments of how you have been treated. And if all you need to do is just continue to expand in this love, you will notice that those moments also are receiving the love. So the very expansion itself activates a healing dynamic in consciousness. And you may notice it in your breathing when these moments present themselves. When you choose the expansion of love, you may notice how your breath changes in that moment and how it yields to further expansion rather than contraction when it is your intent to heal this way. In love, I am healing. You can just sit there and enjoy these 5 minutes. And let the world spin inside your heart, or at least you run around happily in love in the world. However you choose to visualize, if at all you need to visualize, you can just simply sit in the peace and the intention and the bliss of so much love. After a few minutes, 5 minutes plus or minus, just allow yourself gently to open your eyes. Notice how you are. Notice the peace. Notice how your body feels. If you need to readjust your position, by all means do so. If you need to take a sip of water, okay, no pressure. Then you go to the next stage. The next stage is the use of the CBD component to activate in the thymus. Again, if you took a good broad spectrum balanced hybrid, you already have the medicine of the CBD in your system. Now it is a matter of your focus. If you don't, or you are doing this in separate components, then you partake of a little bit of the CBD and you begin this next meditation. This meditation is designed and intended to raise your immune system. This is where you need to understand that there are multiple levels of function of the immune system. And why so much of your time and energy in your life has been spent in your immune system suppressed and forced into operation at the lower level, which I call level 1. And that is the combative nature of the immune system, to attack and try to destroy something which it identifies as not of yourself or not healthy. This is the basis, the logic behind vaccinations and behind symptom treatment in general. We are trying to counteract something that's an expression within ourselves. So much of the immune system has been anti-war, combat, destruction-oriented. Now, wouldn't it be ironic if you were to have just experienced this expansion of love to such an extent that the whole world is spinning in your heart space, and now you're going to partake of a sacred plant medicine for the sake of improving your ability to kill and destroy things? That would make no sense, would it? So instead, what we are looking at is a higher level of function of the immune system, what I call level 2. Level 2 functionality of the immune system is that which brings peace and harmony into the field where there has been imbalance, where there has been invasion even, or there has been toxification, the disharmony energetically in a localized field of the body. does not always have to be met with massive antibody and white blood cell release to try to kill something. The first thing is to bring a greater harmony and a greater peace. That is the nature of the energy and the frequencies and the consciousness that you can direct to permeate that part of the body, and it will effectuate what is called entrainment. It raises the vibrations of the tissues and the substances in the body to be more salubrious, more healthful, and it brings about a greater degree of nobility and function of the immune system. And so through that process, you begin the third meditation. The heart is still expanded. The world may still be spinning inside your heart. And now your focus is to raise the attention and intention to your thymus. And given this infinite love that is flowing from your heart center, of course it is bathing and irradiating your thymus. And now your words, should you choose, may be peace and harmony. There is no enemy. Peace and harmony. There is no enemy. Something of this sort, whatever you may choose to make up. As you focus your attention into the area of your thymus, you may also choose to speak to it in the mind-body connection way. This is where forgiveness resides also. This is where you may say, I release and I let go. I accept peace and harmony. Meditate on that for 5 minutes. While the world continues to spin in your field of infinite love, you are radiating effortlessly. This is a spiritual experience, you see. This you may do for 5 minutes, plus or minus. And then you gently open your eyes. Turn your attention to the next phase. The next phase then is to invoke the spirit and the essence of cannabis sativa. As I stated, cannabis sativa works primarily at the brow chakra and at the crown chakra. So what we do, again, if you have already partaken of a broad spectrum hybrid, then you have already ingested the sativa element, which is psychoactive. If you have separate components, then partake of a very small amount of sativa, and you begin this next meditation. This meditation focuses, as I say, on the brow chakra, or what we call the third eye. And in so doing, the intention, along with what is already in motion, the heart expansion, which is continuing, the emanating of the infinite unconditional love, the peace and harmony within the thymus center, so that there is no enemy. This cultivates the consciousness of defenselessness, which is different from defensiveness, because where there is no enemy, there is no attacker, there is no need to defend. There is love and harmony, and there is balance, and there is entrainment. This invokes many spiritual laws that are not part of most people's everyday life. So as you focus on the third eye, the brow chakra, your focus now is on realization of your own values and beliefs, your own thought processes, your own biases, your own prejudices, your isms, be they racism, sexism, nationalism, fascism, pacifism, loveism, whatever it is that constitutes your constellation of beliefs. You simply allow that awareness to flow without harsh judgments. Without harsh judgment. This is who I have known myself to be. These are my beliefs. These are my values. I witness them. All the while, my heart is open infinitely in love. All the while, my immune system knows that peaceful coexistence is far greater and far more beneficial to all. than is warfare and combat. And so directed at myself as my own internal review of my beliefs and my values, my thought processes, this same love and peaceful intention, it even embraces all my thoughts. I may come to make certain decisions during that time, as many things become flashed across my inner screen of vision. And I may decide there's certain things I choose to no longer believe, maybe certain biases, maybe certain even bigotries, maybe certain beliefs and values that may have been more of my parents' generation or my ancestral or my cultural orientation. It is not necessarily what I choose to hold on to now. And I may even have a realization of certain things that were foundational to me and yet have not been so present and active in my life, and I may in this moment choose to reincorporate that, to re-embrace those beliefs or those values or those cultural heritage elements, undergo a forgiveness within myself and within my marriage, my family, my community, my world. All of these things may happen when the focus is at the third eye, at the brow chakra. This is what the psychoactive effects of sativa have been primarily calling for people who have used it, even recreationally. This is what they have wanted. To have some sense of calming the mind, of feeling self-acceptance. And so in the 5 minutes, more or less, one can focus at the third eye and have the experience of the sativa as a sacrament, not as a dope, not as a drug, as a sacrament that begins realization and choice. 5 minutes, plus or minus, gently open the eyes. You're about to go to the 5th stage. The 5th stage is the activation of the crown chakra. What was called the fountainhead because one may attain a state that feels like you are just opening up and becoming pure light. Connection. What brings the connection of the center channel of energy and consciousness, and that which opens you to your sense of source connection, your sense of God experience. In many, if not most, major religious systems on this planet, you will see something about an illuminated being. Maybe it's the halo around the head, or maybe it's around the entirety of the body, or depictions of light that are emanating from this person. In general, the focus especially is on the heart, and it is on the crown. So you may experience this in the next 5 minutes. One already has the sativa in the system. You simply change the focus now to the crown. Now I understand that for many people they're so blissed out by the time they're focused in the brow chakra, they don't want to open their eyes. They just transition into the next 5 minutes and shift the attention a little bit more towards the crown, and that's fine as well. But you can break it up momentarily should you choose. The focus upon the crown, therefore, is connection, is release, is knowing God, is knowing Source, is knowing Universe, is knowing Creator, is knowing answers. Even if you are an atheist, this is a good time for you to simply witness what it's like to open your consciousness to whatever. It is fine. It doesn't require you to be religious. It will be, for you, a spiritual experience. It is here in the fountainhead that healing takes place. The healing that takes place now is the response to the intention, proclamation, the declaration, and even the command, lovingly, infinitely set forth, that there be a restoration of the memory of holos, of wholeness. This is what holos means in Greek, healing. the restoration of the memory of wholeness, and it also means the return to source. So through this process, one is able to attain an alignment of the physical, the emotional, the mental, and the spiritual bodies through this sacred use of cannabis in this manner. Surely, if you want to stay in meditation and spend the night there, it's fine. But really, the process, if you would give it at least that roughly half an hour to do these 5 segments of roughly 5 minutes each, with a little bit of preparatory and a little bit of summative, that's your spiritual experience. That's your sacred usage. And as I said earlier, perhaps for the first half hour, the first half of an hour is your medicinal use to allow you to be able to enter the sacred space for the second half hour, and thus 1 hour total. It is not necessarily something that you have to do each day. Yet if it were something for you to do each day, you would surely come to find that your medicinal need declines further and further. You would come to find that your desire for recreational use recedes so quickly into the background of your life. You will come to find that your predisposition towards addictive behaviors, if that was such with you, declines and heals. You will find that your ability to manage your emotional states and your psychological states expands. You will find that there is peace in your night, that you can sleep. You will find that the barriers to intimacy, which so painfully smote you and others and kept you in that experience of separation, that these barriers dissolve. You find you can be more present, you can be more open. If you are a professional and you engage with patients or clients or customers, you will find that intimacy is there. If you are a seeker, a student, a scientist, a researcher, and you are seeking truth and understanding, you will find that your capacities are expanded. If you're a critic, an analyst, you will find that your perspective of analysis and critiquing is an expanded perspective. And thus you will likely find that harshness fades from your portfolio, from your toolbox. It is no longer necessary to be harsh in order to affirm your legitimacy as a critic, as an analyst, as an expert. And you will find that it is easier for you to move about in this life and in this world with tolerance, acceptance, and allowance for so many of those things and people and situations that irked you, that you resented, maybe even that you struggled against, fought against, or maybe even desired their elimination, because you will become much more at peace. You can become the anchor, the true anchor of love, peaceful presence in your home, in your family, in your community, in your church, your school, your job. This is what happens when we make use of what Creator Source has given us through the natural medicines, when we regard them for what they are intended for, as medicines and as sacraments. I trust this is useful. Thank you.